Doctors of Reddit, what's the biggest case of faking it you've ever seen? Story 1. One of the biggest challenges is that it's often difficult to tell when someone is faking. I frequently see people exaggerating minor issues, like making up excuses for sick leave, and the number of people pretending increases when there's a free event happening. In the ER, it's common for patients to play up their symptoms to make their case seem more urgent so they can be seen faster. I once witnessed a father coaching his young son, around 8 to 12 years old, to repeat serious symptoms to the doctors just so they could get ahead in line. Story 2. I'm a dentist, and I once had a patient come in with a severe toothache that required extraction. The procedure went smoothly, and the patient left in good condition. However, just 20 minutes later, they called back, claiming they were in unbearable pain, an 11 out of 10, and requested a prescription for oxycodone. The next day, they returned to the office in tears, looking completely distraught. I started to feel concerned, thinking they might actually be in real pain. But after examining their mouth, I found that everything was healing normally. Despite this, they once again demanded oxycodone. When I refused and suggested alternative pain management, their entire demeanor changed. Suddenly, they became aggressive, yelling and throwing instruments. Security had to escort them out. That experience taught me just how far some people will go in pursuit of narcotics. Story 3. Anyone who has worked in an ER has seen cases of malingering, drug-seeking behavior, pseudo-seizures, and conditions like Munchausen syndrome, both in individuals and by proxy. Two of the most disturbing cases I recall involved both forms of Munchausen. The first case was a mother who repeatedly brought her 2 toddlers to the hospital, claiming they were vomiting blood. Even though the children seemed fine, they were transferred to a pediatric ward. This mother was already known to us for her psychiatric instability. I consider this one of the worst cases I've seen because those poor kids barely have a chance at a normal life. The second case was a patient with Munchausen who had experienced multiple episodes of septic shock requiring pressors. She had already lost several fingers due to previous Levophed infusions. Over the course of 3 months, she was hospitalized 5 times for sudden, severe drops in blood pressure. Something didn't add up as her initial vitals and exam were never that alarming. Suspecting foul play, we started drip, and just like that, her blood pressure returned to normal. Even though her drug screen came back clean, we realized she was likely dosing herself with street fentanyl after intake. She attempted the same stunt multiple times after that, and each time, drip immediately resolved the issue. We ended up contacting other hospitals in the area, all of which had also treated her recently, to alert them to what was going on. Story 4. Psychogenic seizures, or pseudo-seizures, are a fascinating phenomenon. I once had a patient in the middle of an apparent seizure, so I firmly told them to stop. They continued to seize while also yelling at me, "I can't stop, I'm seizing." Pro tip: you can't have a grand mal seizure while holding a conversation. Just to clarify, psychogenic seizures are not voluntary and can have serious effects on a person's well-being. However, in this particular case, the patient was most likely faking in an attempt to obtain medication. Story 5. A patient came in with a family member claiming they had epilepsy and needed benzodiazepines. While I was gathering basic medical history, the patient suddenly started having a seizure, rolling on the ground, shaking their head, and kicking their feet. I calmly asked if they needed any assistance during the seizure. To my surprise, they responded mid-seizure, confirming that they were having one. The family member tried to convince me that this happens every day and that the patient urgently needed benzos. I politely explained that these were psychogenic, non-epileptic seizures and recommended that the patient see a psychologist for further evaluation. They didn't take the news well and left in disbelief. Story 6. I'm a nurse working in acute rehab, where patients come for physical therapy and recovery after surgeries or illnesses. One patient really played us. This guy was medically stable and ready to be discharged, but was extremely anxious. He constantly asked me to recheck his vitals and blood sugar, always coming up with new concerns. His hand was twitching, he felt dizzy, his vision was blurry. I thought I was doing a good job addressing his worries and keeping him calm. Then one day I checked his vitals and his pulse was low, around 48. Everything else looked fine, so I wasn't too worried and told him I'd check again in a few minutes. When I returned, he looked noticeably worse. His pulse was still low, his oxygen levels had dropped, and he seemed sluggish and slow to respond. I called in my charge nurse, and we started worrying about a possible opioid overdose. As we discussed it, his breathing became shallow and even slower. We called the doctor, gave him Narcan, and called EMS. By the time they arrived, he was nearly unresponsive, barely reacting to a sternal rub. EMS administered more Narcan, but there was no effect, so now we were thinking stroke. We noticed a slight droop on one side of his mouth. Was that always there? Had I missed it? After rushing him to the hospital, they did a full workup since he was high risk for multiple conditions. The next day we followed up. Turns out nothing was wrong with him. The guy must have heard me mention his low pulse and thought, this is my chance. I'm pretty sure he held his breath when I checked his oxygen levels, let his mouth droop when he heard stroke, and probably skipped lunch to make his blood sugar drop. All of this just because he didn't want to go home. Well, now he's banned from our facility. Story 7. A few years ago, I absolutely hated my boss, so I frequently called out of work, claiming I had severe migraines. After seeing the same doctor multiple times, he eventually referred me for an MRI to check my brain. I played along. 3 hours later, I was being rushed to the emergency department at my local hospital. They had found 2 aneurysms in my lower brain. I had never actually experienced those headaches. I was completely faking them, but in the end, it turned out to be a blessing in disguise. Story 8. Once I was hospitalized for a severe muscle injury in my lower back. I couldn't sit up without experiencing excruciating pain, so I had to remain lying down. My nurse, however, thought I was faking it. Without warning, she suddenly cranked my hospital bed into a sitting position. I immediately felt the worst pain of my life, screaming, sobbing, completely overwhelmed by it. She quickly lowered the bed again, but the damage was done. The injury felt significantly worse after that. Her assumption that I was exaggerating probably added a lot of time to my recovery. So yeah, maybe medical workers should be a little more careful before deciding that someone is faking it. Story 9. I'm an emergency medicine doctor. Pseudoseizures are pretty common, and while some people fake them to get IV benzodiazepines, most actually have seizure disorders, but also struggle with underlying psychological issues. Many of them aren't trying to be deceptive, they're just overwhelmed and don't know how to cope with stress. That said, I've encountered all kinds of people faking symptoms, but the most cunning one was a guy I'll call Steve. Steve had to have some medical background, probably a nurse or a tech. He was tall and thin and claimed to have Marfan syndrome, a rare connective tissue disorder that makes people taller, lankier, and more prone to aortic dissections. If you're unfamiliar, an aortic dissection is when the main artery carrying blood starts tearing apart. It's a life-threatening emergency. Steve didn't just claim to have Marfan's, he insisted he had previously suffered a dissection and that it was treated by a well-known surgeon at a real hospital. He would then show up with classic symptoms, severe tearing chest pain radiating to his back. But Steve didn't stop there. He manipulated his blood pressure readings by flexing one arm when the cuff was on, then relaxing on the other arm, creating a major discrepancy, which is a textbook sign of aortic dissection. On top of that, he claimed to have a severe allergy to contrast dye, forcing us to pre-treat him with Benadryl and steroids, which added an 8-hour delay before his scan. During that time, he would repeatedly request opioids. He also conveniently experienced nausea and requested Phenergan. For those who don't know, the combination of IV dilaudid Phenergan and Benadryl is one of the most potent euphoric hospital drug cocktails out there, highly sought after by opioid seekers. I got Steve on his 3rd visit. The first 2 times, his scans showed no dissection, but he was smart enough to keep coming back. Unfortunately for him, this time he made the mistake of arriving during normal business hours. I was able to contact the surgeon he had name-dropped, who confirmed he had never treated Steve, but had received multiple calls from different hospitals about him. I still offered to do the CTA, the scan that would confirm a dissection, but told Steve he wouldn't be getting any opioids. He stormed out in anger. No one has seen him since. I'm sure he's moved on to a new hospital by now. Story 10. I work in medicine, but I'm not a doctor. I once saw someone come into the ER after throwing themselves down a flight of stairs in an attempt to get opioids. Miraculously, they were fine, except for completely wrecking one of their knees. We offered them physical therapy and a knee brace. They were not happy with that outcome. Story 11. A doctor once accused me of faking my symptoms and wasting everyone's time. After he left, the nurse came in and we started talking. She asked if I had started any new medications. That's when we figured out I was having a severe reaction to my antidepressants. They were making my body feel like it was shutting down. So, shout out to nurses for actually listening, and shame on that hospital for overworking their doctors so much that they didn't have time to figure out what was really happening. Story 12. I'm not a doctor, but I come from a family of nurses. Dinner conversations were always full of wild stories. My mom's side of the family actually has Ehlers-Danlos syndrome, and I also have fibromyalgia. One relative, however, insists she has every medical condition under the sun, to the point where we've all suspected Munchausen. My personal favorite was when she confidently told me that a blood test confirmed she had Ehlers-Danlos. For those who don't know, that's not how it works. Ehlers-Danlos is diagnosed by a geneticist, not a standard blood test. Let's just say many tongues were bitten that day to avoid an argument. Story 13. A patient was faking seizures while the doctor was taking their history. Doctor, are you experiencing double vision? Patient, yes. Doctor, you close your left eye. Do you still see double? Patient, yes. Doctor, do you close your right eye? Still double? Patient, yes. That's not how double vision works. In this particular case, the patient also fell during a seizure, but caught themselves and gently laid down to avoid getting hurt. Story 14. An ER patient checked in complaining of severe dental pain and claimed to be allergic to every single NSAID. This was a small rural hospital, so I happened to see the guy head across the hall to the lounge, pour himself a giant mug of hot black coffee, and sip it casually in the waiting area. When I asked about his dental pain, he claimed it was excruciating and worsened whenever he drank hot or cold liquids. His head and neck exam showed nothing significant. He was discharged with instructions for supportive care, including ice packs, and advised to follow up with his dentist. He did not take it well. His dissatisfaction was loud and very colorful. Story 15. I'm a resident, though not in psychiatry. This happened during my psychiatry rotation in medical school. We had a patient at an inpatient psychiatric facility. She repeatedly insisted that she had a lump in her breast and demanded to be examined, but only by male doctors. When the psychiatrist I was working under declined, she then asked me to do it during our daily patient interview. I also refused, but had a gut feeling to check her medical records. It turned out she had undergone an ultrasound just a week before, which showed nothing abnormal, just normal breast tissue. However, I also found a pattern in her records. She had visited multiple doctors' offices with vague complaints, often focusing on breast or vaginal issues when seeing male physicians. We diagnosed her with factitious disorder, previously known as Munchausen syndrome, and histrionic personality disorder. Her primary goal seemed to be attention from medical professionals, though we also had to be cautious about potential lawsuit fishing. Cases like hers are a big reason why doctors document everything meticulously. Interestingly, she never admitted to making things up. According to the psychiatrist I was working with, she didn't actually believe she was sick. Her goal was the attention itself. If she had genuinely believed in her illnesses, she would have been diagnosed with illness anxiety disorder, commonly known as hypochondria. Story 16. I was always terrible at lying. So when I wanted to get out of school as a kid, I would actually hit myself in the stomach. That way, I wasn't technically lying about having a stomachache. Looking back, the teachers must have thought I was a victim of some horrific bullying, but no one ever said anything about the bruises. Now that I think about it, that whole situation was awful in so many ways. Story 17. Don't get me wrong, when the ER is packed, space is tight, and staff are maxed out, it's easy to get frustrated with regulars or patients who don't understand that their issue isn't a medical emergency. But at the end of the day, we should still treat them with compassion. We don't always know what trauma led them to this point. We're lucky that our brains process things differently, allowing us to help those who can't cope the same way. I've come to accept that in the ER, I'm not here to fix their past, I'm just here to help them today. The least I can do is be kind. Story 18. I'm a doctor. I used to share stories about fakers in the hospital, but over time, I've realized that many of these patients are dealing with severe psychological trauma, which manifests as physical symptoms. Even malingerers are often in a terrible place in life, no matter how entertaining their stories might seem. That doesn't mean we shouldn't be cautious, but it does mean we should approach them with more compassion. Story 19. I miss the days when you didn't need a fake doctor's note just to take a mental health day with your kid. My parents did that every once in a while for me and my sister, and those days off ended up being some of my best childhood memories. Story 20. I used to work as an EEG tech, and one day we had a patient come in from the ER at the end of our shift. To speed things up, we had the consultant neurologist with us to formally assess the study. At first, this woman seemed to be faking her symptoms, and not very convincingly either. Still, we had to go through the motions, except she wasn't faking, she was actually having epileptic activity. She managed to fool a veteran neurologist, an EEG tech with 25 years of experience, and a few of us newer techs with a few years under our belts. Lesson learned, never assume. Story 21. I once saw a father and son wink at each other just as I finished writing the kid a note to stay home from school. That's pretty much it, just a reminder that faking it is often a tough call to make. Story 22. I'm a nurse. We had a geriatric patient who abused the call bell constantly. She wasn't in distress. She just liked the attention and seemed to think the rehab ward was a hotel. Our job was to encourage patients to regain their independence, but she insisted on having everything done for her. She'd ring the bell for things like, please lift my blanket, or pass me my phone, or even feed me. She claimed her hands didn't work. The problem? I caught her multiple times lifting herself off the bed, grabbing her phone when it rang, clearly using her hands just fine. After days of telling her she needed to start doing things herself, she grew increasingly frustrated. Finally, she snapped. She grabbed me by the collar, shook me, and screamed, "What don't you understand about the fact that my hands don't work?" I just blinked at her as she slowly let go. I guess I healed her hands. Praise the Lord. Story 23. One of my employees, I work for the federal government, requested 2 weeks of annual leave just 3 days before he wanted to leave to go home to Puerto Rico. Request denied. The schedule was already posted. So instead, the guy calls in for 80 hours of FMLA sick leave on the exact days he wanted off. When he returned, he had a doctor's note in Spanish from a clinic in San Juan and a properly documented FMLA case number. He got us good. Damn. Story 24. A supervisor at a former job called in sick. The next day, he came in with a fresh tan line right across his forehead from golfing in the sun all day. No one said a word. Meanwhile, I once had to leave town for a last-minute family visit. Got written up for it. Should have taken up golfing. Story 25. Not a doctor, but I have a funny workplace story from a few years back. A guy calls in sick for about 8 days, claiming he's really unwell. When he finally returns to work, he's tanned as hell. Hands his medical note to the manager. It's in Spanish, with an official seal from some random Cuban clinic. Then he casually walks over to me with a grin and says, "Yeah, I'm probably fired." He was fired. Story 26. My mom's an ER nurse. One time, a woman came in claiming she had whooping cough. Every time she coughed, she followed it up with a dramatic whoop. Story 27. I'm a nurse. Once had a patient in the ER faking a seizure. The other nurse and I knew it. He said as much. Right then, the patient miraculously stopped seizing, looked him dead in the eyes and yelled, "Shut up, fat boy." We laughed so hard. That nurse was known as Fat Boy for months after that. At least she wasn't having a real seizure. Story 28. As a kid, I meticulously planned my sick days in advance. I had an old thermos where I'd pour leftover milk, meat scraps, whatever I could find. I'd seal it up and leave it on my bedroom windowsill for a month, letting it fester. No smells escaped because the lid was tightly closed. Then, on my planned sick day, I'd set an alarm for the middle of the night, dump the contents of the thermos onto my bedroom rug, and rush to tell my dad I was throwing up, and so there was just one problem. The stench from that thermos was so unbearable that it filled our entire condo. My dad walked in, gagged, and immediately started throwing up too. Both of us ended up puking into the bathtub every time we tried to clean up the mess. He had to take the day off work. Needless to say, I never tried that stunt again. Story 29. I'm an ICU and ER nurse. We see a lot of malingering in the ER. One day, one of our frequent flyers came in and started faking a seizure in triage. Now, I know this lady. She's seized a million times before. But this time, she was putting on her show in front of a packed waiting room with about 30 horrified people watching. She's rolling around on the floor, making a scene, and I just walk up to her and calmly say, "Karen, what are you doing?" Without missing a beat, she yells back, "I'm seizing." I told her to stop seizing, so she did. Story 30. A 30-year-old woman came to the ER with excruciating belly pain, claiming she was paralyzed and screaming, "Oh God, it hurts when you press there. I need oxycodone now." The doctor looked at her and said, "If you can get out of that bed and do 20 jumping jacks, I'll give you the oxy." She did 20 jumping jacks. Then she got kicked out of the ER. Story 31. As a kid, I learned I could fake being sick to get out of school. Once or twice a week, I'd clutch my head, complain about a migraine, and get sent home. Eventually, my parents took me to a neurologist. After a brief chat, the doctor suggested, maybe just don't let him eat chocolate and sugar. I caved, admitted to faking it. I was grounded for a very long time. Story 32. I had the opposite experience growing up. I had real migraines, 3 or 4 a week, but because I looked fine most days, everyone assumed I was faking it. I just got used to pushing through the pain and acting normal. It wasn't until 8 years later that I finally saw a neurologist who diagnosed me with chronic migraines. I dealt with them unmedicated for 16 years. Now I'm finally on medication, but I can't help but feel like my childhood was wasted. Story 33. When I was about 8 or 9, I was getting migraines 3 times a week. My doctor told my parents I was just faking it to get out of school and gymnastics. At 12, I was diagnosed with a hindbrain hernia. 2 weeks later, I had cranial decompression surgery. So yeah, I definitely relate to the whole trying to act normal thing. Story 34. I also had migraines as a kid, but my doctor said I was too young to have them. No one believed me until I was a teenager. medication doesn't help much, but at least now I know to. I've tried multiple medications, diets, and treatment plans over the years. Medical cannabis isn't legal in my state, and my past experiences with it weren't great. Turns out I'm the type to get really sad when I'm high. Everyone else would be chill, and I'd be sobbing for hours. The only pattern I've noticed is weather changes and barometric pressure shifts, but I still get migraines at other times too. My doctor suggested moving to a place with a stable climate like San Diego or Honolulu, but that's not exactly an option right now. Oh, and I react horribly to triptans, tight throat, muscle stiffness, trouble breathing. After the second bad reaction, an ER doctor straight up told me, "Yeah, you should never take triptans again." Story 35. My son started getting migraines around age 7. When he has one, he just lies in a dark room with an ice pack and a puke bucket trying not to move. I always believed him because honestly, what kind of little kid fakes being sick just so they can lie motionless in the dark for 8 hours? Story 36. My EMT instructor once told me about a seizure call his crew responded to. They arrived to find a woman unconscious, buck naked, door wide open. They began assessing her while one guy cleared the house to make sure no one else was there and grabbed something to cover her. After checking her pupils and doing an arm drop test, they realized she was faking, but their policy was to never call out a faker, just roll with it. So my instructor starts arranging for transport to the hospital when one of his guys blurts out, "Captain, she's clearly faking it." Right then, this unconscious, unresponsive woman snaps back, "No, I'm not." Story 37. I work in ophthalmology. People fake blindness all the time. One of my favorite moments was when I went to check a patient's eye pressure using a Tonneau pen. For those who don't know, it's a device that literally touches your eye. As soon as I brought it near their face, they recoiled and screamed, "What the hell is that thing?" Yeah, totally blind. Story 38. ER nurse here. I was bringing a patient back to a room. He said he had kidney stones. I had him stop at the bathroom to give a urine sample. Dude comes out with a specimen cup that literally has a piece of concrete in it. I looked him dead in the eye, waiting for the joke. He was serious. I threw it away and walked his dumbass right back to the waiting room to contemplate his life choices. Story 39. Not a doctor, but I was in the ER one night and watched a drug seeker in action. This guy would sit there completely fine, no wincing, no movement, nothing. But the moment a nurse or doctor was in the vicinity, he'd start moaning, clutching his stomach and whining in pain. As soon as they walked away, poof, back to normal. It was exactly like those little kids who are fine until they spot their mom, then suddenly collapse into tears. Story 40. My mom was an ER nurse. Years ago, they brought in a prisoner from the local pen, totally unconscious. The guards were very suspicious that he was faking it. They checked his vitals, everything looked fine. The attending doctor tried poking his foot with something sharp, no reaction. Then he had an idea. They took a rubber hose and started inserting it into the back of his throat, as if they were intubating him. That did the trick. The guy sat up immediately, coughing and gagging. Story 41. Here are some of my favorite ER moments. 18-year-old male unconscious for 4 hours. When I checked his lungs, I heard something odd. Put my stethoscope near his mouth. He was literally whispering "breathe" every time he exhaled. No joke. 21-year-old male, unable to speak for 2 hours, struggling to breathe. We put him on oxygen. After taking him off, his dad ran to me, panicked. His son's tongue was sticking out and wouldn't go back in. I walked over. Kid was just lying there with his tongue poking out. I told them to push it back in. A few hours later, Dad said his son was having seizures. I checked in without announcing myself. Kid was fine. The second I asked how he was doing, he started convulsing. It looked like an awkward version of the worm, but on his back. 16-year-old female, admitted for seizures and foaming at the mouth. When I looked at her, she was literally just blowing spit bubbles. I checked her reflexes. Everything was normal. The second I turned away to check another patient, she suddenly went rigid and the bubble blowing intensified. 30-year-old male, unconscious for 6 hours. This guy really committed to the act. I initially thought it might be a stroke, but all his vitals were completely normal. I started checking pain sensation, and slowly he began groaning and cracking his eyes open. But the moment I pressed on his Achilles tendon, he sat straight up, stated his full name, and announced that he was cured. A 17-year-old female, complaining of breathing issues and convulsions. Everything was fine on admission, but she refused to eat. Her parents were panicking because every few minutes she'd have a fit where she'd just shake from side to side. Turns out, she told a nurse that she was faking it to get out of school. Since she wouldn't eat, the attending ordered a nasogastric tube. She yanked it out within minutes. Story 42. A prisoner came in showing all the classic signs of a major stroke. At the time, the protocol was to first do a non-contrast head CT to rule out a bleed. If there was no bleeding, we'd give TPA, a powerful clot-busting drug that's only worth the risk if it can prevent serious stroke damage. So we followed the protocol. Later, though, he started getting a little too comfortable with his act. He began adding new symptoms that didn't match up with his diagnosis, and that's when we figured out the truth. He was faking the whole thing just to get a little time away from... Story 43. I used to work in the ICU, and one day a family member showed up out of nowhere to visit a sedated patient on a ventilator. This person never left, stayed day and night, constantly hovering. Something felt off. They clearly didn't actually know the patient. I decided to test them. Casually, I mentioned how sad it must be, since the patient had just celebrated their birthday, right before getting sick. "Oh, it was a wonderful party," they said, going on and on about the celebration. One small problem, the patient's birthday wasn't for months. Security came, and sure enough, the family member turned out to be a homeless person who had snuck in, found a room with an unconscious patient, and decided it would be a good place to stay. Needless to say, ICU security was not great back then. Story 44, fourth-year medical student here. During my ER rotation, we got a trauma case, an arrested woman who had allegedly knocked her head against the window of the police car 4 times before suddenly becoming unresponsive. She arrived at the hospital with a forehead bruise, totally unconscious. We all smelled the BS immediately, but she was good. Never even flinched during the digital rectal exam, which is standard for trauma patients. Some of the nurses swore they caught her peeking at us when we left the room. We ran a CT scan, normal of course, and even debated intubating her just to secure her airway. Then finally, our attending walked over, pried open her eyelids, and told her firmly to wake up. Suddenly, she started fighting to keep her eyes shut. Well, the jig was up. The doctor called her out, and just like that, she woke up, screaming at us. Honestly, she was much more pleasant when she was pretending to have a brain injury. Story 45, I'm a surgery resident. During my trauma rotation, we had a patient come in after a car accident. There was some concern that maybe he had seized while driving, which could have caused the crash. So he's lying in the trauma bay when, right on cue, he starts shaking. The trauma nurse takes one look and says, "Oh, this isn't a real seizure." The guy immediately stops shaking, sits straight up and yells, "You don't know a fumming thing about me." Yeah, totally legit. Story 46. I'm an audiologist. I specialize in hearing loss and have worked both in private practice and with the VA, handling veterans' disability claims. People fake hearing loss all the time. For me, the hearing test actually starts the moment I call their name in the waiting room. I say it at a normal volume. If they respond, I already know their hearing isn't worse than mild loss. One guy answered perfectly fine, walked in, and had a normal conversation with me. Then, when the actual test started, I instructed him over the headphones, raise your hand when you hear the tone. I played the tone at 50 decibels, a very clear, normal volume. No response. I turned it up and up and up. By the time I hit 100 decibels, so loud that it was physically painful, this guy was flinching but still refused to raise his hand. I knew exactly what I was dealing with. I've taught entire classes on how to catch fakers and estimate their actual hearing ability. Long story short, I wrote a damning report outlining all his inconsistencies. The part that stuck with me, we had a really nice conversation before the test. He was a fire chief, and I have firefighters in my family. We really got along. If it weren't for the professional boundaries, we probably could have been friends. But then he tried to game the system for a disability check, and it pissed me off. Story 47. Years ago, I had a patient who had been rear-ended in a car accident a few weeks before I saw her. She also had a history of lupus. When she arrived at my office, she was decked out in full I'm crippled gear. Crutches, a neck brace, elbow braces, wrist braces, knee braces, the whole package. She could barely walk. I saw her a few times, but she showed no improvement. One Saturday, I was on call and had to take the back roads to the hospital because the main roads were blocked for an event. Apparently, I passed through her neighborhood because lo and behold, there she was, power walking down the sidewalk in full old lady spandex, holding weights in both hands. I didn't call out to her. The next week, she was back in my clinic, back in her crippled getup. A few weeks later, I got a subpoena for a deposition. Suddenly, everything made sense. Story 48. My cousin got glasses. Her 7-year-old little sister immediately decided she wanted glasses too because she thought they were cool. So she started telling her teachers she couldn't see the chalkboard, squinting dramatically at home and sitting right in front of the TV, complaining everything was blurry. Her parents got worried and took her to the eye doctor. During the vision test, she intentionally read everything wrong. The results suggested she needed extremely thick glasses, which was suspicious because that level of impairment was rare, especially since neither parent had vision issues and her sister only had mild astigmatism. The doctor quickly realized she was faking, so In front of her, he told her parents that she would need immediate and intense eye surgery if she ever wanted to see properly again. To sell the story, they even wheeled in a machine, acting like they could do the surgery right then and there. She freaked out, confessed to everything, and started crying. She got grounded for a long time. Story 49. When I was a medical student working in the pediatric ER, we had a tradition. Every kid got a popsicle. One afternoon, an 8-year-old boy came in with his dad. I asked what was wrong. The kid couldn't remember what he had complained about to his dad. The dad couldn't remember why he brought the kid in. Apparently, the boy's mom was a nurse and normally kept track of these things, but she was working at another hospital that day, so there they were, completely clueless. After a few minutes of confusion, the kid finally asked, "So, can I have my popsicle now?" The kid was 100% healthy. Unfortunately, we totally reinforced his behavior because both he and his dad walked out with popsicles. Story 50. Not a doctor, I'm a nurse. We had a guy who came in every 3 months to get a medical certificate saying he was too disabled by back pain to work at his retail job. He was receiving large amounts of insurance money for this condition. As usual, the doctor did his exam, asked a few questions, signed off on the paperwork, and handed it over. Then, as the guy was about to leave, he casually asked, "Hey doc, can you check my shoulder too?" The doctor examined it and asked, "How'd you injure it?" "Oh, playing rugby," the guy said. "I'm on a competitive team." The doctor blinked. "Really? How long have you been playing?" "Oh, the whole time." Doc wrote that information on the insurance form, then he went to the staff room and lost his mind laughing. The next week, the guy showed up at reception losing his mind in rage because his insurance had been canceled. Story 51. I was working in the ER when a guy came in complaining of severe stomach pain. While taking his history, he casually mentioned that he had a fight with his girlfriend. She left angry, and he fell asleep on the couch. We ran a CT scan. Turns out he had a satellite cable remote wrapped in a condom lodged deep in his rectum. I never got to hear his conversation with the doctor, but I was dying to know how he planned to explain why his angry girlfriend was still kind enough to thoughtfully wrap it in a condom first. Story 52. I'm a nurse, not a doctor. We had a patient who worked as a hospital janitor, so he knew just enough medical jargon to fake his way through things. He was seeking pain meds, specifically morphine, claiming he had severe chest pain. He went through a full cardiac workup. Everything was fine. Then he switched tactics. "Oh, maybe it's my stomach." Cleared again. Then, just before discharge, "Wait, no, it's chest pain again." Cleared. Again. Now, he's my patient. I'm a fresh face. He suddenly starts complaining of abdominal pain this time. I call the doctor, who already knows his history, and he says he'll be up soon. Meanwhile, the patient asks for ginger ale. A few minutes later, my coworker storms into the break room disgusted. This man had taken a dump in a basin, poured ginger ale over it, and then tried to claim he was vomiting feces, and of course needed Dilaudid immediately. I walked into his room, took one look at the pile of shit in a puddle of ginger ale, and told him, "Well, looks like we'll need to take away all food and drinks and insert an NG tube." Suddenly, he had a miraculous recovery. He admitted to faking everything. Story 53. A nurse I used to work with told me this one back when we had a psych unit. It's not unusual for psych patients to stash things in various orifices, but this case was something else. A woman came in convinced she was impregnated by a ghost-like figure. Nobody believed her, obviously. Then one day she started complaining of massive pelvic and uterine pain. She called them contractions. The doctor went to examine her and felt something large inside. They set up a procedure table to carefully remove whatever was in there. Meanwhile, the woman was fully committed to the act, shouting, "Should I push? I'm gonna start pushing." The doctor tried using forceps to extract the object, being as gentle as possible. Finally, he got a grip and started to say, "Got it." And that's when he pulled out a baby doll, just the head. One of the third-year medical students went pale, nearly passed out, and almost hit the floor right there. He never lived that down for the rest of his rotation. Story 54. One time, my roommate, who's an ICU nurse, came to watch my indoor soccer game. During the match, a player on the opposing team suddenly went down hard, screaming in pain, rolling around, swearing, clutching his ankle. They had to help him off the field. He then limped over to the sidelines and sat silently brooding for the rest of the game before leaving early. Afterward, my roommate told me he was going to go check on the guy until he noticed something. The dude was limping on the wrong leg. Story 55. I'm a nurse for an ophthalmologist. One day, a 21-year-old new patient came in claiming he was completely blind due to a sudden and severe glaucoma diagnosis from a mysterious unnamed doctor. He really committed to the act, feeling his way around while walking, rolling his eyes back, the whole dramatic performance. He even said he was a famous YouTube rapper and was now unable to make videos or earn a living. Feigning excitement, I gasped and said, "Oh my gosh, I think I've heard of you before. Let me subscribe to your channel." Then I held out my phone and asked him to search for his YouTube page. Without hesitation, he snatched my phone, effortlessly opened the YouTube app, and flawlessly typed in the search bar. Eyes suddenly back to normal, fully focused on the screen. Miracle recovery. Story 56. I'm a physical therapist. A working mom came into the clinic pushing her baby in a stroller, limping like she'd stepped on a nail. She was wincing in pain, tears in her eyes, even crying during her session. None of us thought for a second that she was faking. She limped dramatically out of the clinic after her appointment. A few minutes later, I glanced out the window, and there she was, bounding down the sidewalk at full speed, hips swaying, full stride, power walking like she was late for a flight. We were all fools. Story 57. Whenever we had teenagers exaggerating their symptoms to extend their hospital stay, we had a simple solution. We ordered them onto a strictly healthy lifestyle. Lights out at 9 p.m. No screens for 2 hours before bed. A nutrient-rich diet full of fruits and vegetables. Limited screen time. Mandatory laps around the unit for daily exercise. Amazingly, they always got better very quickly. Story 58. A patient came in for back pain, claiming he had severe leg weakness. He got a full workup, MRI, blood tests, even specialized immunological tests to rule out conditions like myasthenia gravis. Everything came back completely normal. Physical therapy evaluated him and immediately suspected he was intentionally holding back. At the end of the day, my attending and I went to discharge him. He was livid, screaming, ranting, furious. "I can't believe you're sending me home already. I haven't even told my family I'm here, and now they won't even get a chance to visit me." We left the room for a few minutes to update the nurses. When we returned, the guy, who could barely move his legs all day, was now standing up in the middle of the room, perfectly fine. He was suddenly even more furious that we hadn't knocked before walking in. He was discharged after a brief discussion about abusing medical services. Story 59. During my intern year, we had a patient pretending to be blind. She was on her smartphone constantly, but would frantically hide it whenever a doctor or nurse entered the room. One day, my attending casually strolled past her room and threw up a massive, exaggerated wave as he walked by. Without thinking, she started to wave back, then caught herself halfway through, snapped her hand back into her lap, and resumed her staring into nothingness act. Story 60. My brother was an EMT for 2 years, and he told me this gem. Some people would fake seizures just to get an ambulance ride from Fulton to Oswego, since the hospital was in Oswego. One EMT in particular had a hilarious way of handling these situations. If he knew the person was faking, he'd casually say something like, "Man, it's weird that he's having seizures but hasn't peed himself." 9 times out of 10, the faker would snap out of it for a second, mentally weigh the consequences, and then either actually pee themselves to keep up the act, immediately stop faking and act normal again. Either way, they gave themselves away. Story 61. I'm a pediatric neuropsychologist. I got a referral for a patient who had been through countless specialists and ER visits. He was 13, wheelchair-bound, on therapeutic oxygen, suffered from seizures, arthritis, musculoskeletal problems, suspected autism, was completely nonverbal, and had severe behavioral challenges. The list went on and on. He was being followed by at least 8 different specialties, none of whom seemed to be communicating with each other. His medication list was 18 prescriptions long. The case got kicked to me after yet another ER trip, when a doctor finally said, "Something isn't adding up." Turns out it was factitious disorder by caregiver, aka Munchausen by proxy. Every symptom had been parent-reported since he was about a year old. It may have started with a legitimate febrile seizure in infancy, but no one had ever witnessed any of the reported medical crises, except his mother. She had convinced multiple doctors that her son was severely ill, told him he was dying, and even got him a Make-A-Wish trip and charity donations. He was removed from her custody and taken off most of his medications. Within weeks, he was out of the wheelchair, off oxygen, playing basketball, super talkative and friendly, no behavioral issues. He did have a significant intellectual disability, but it's impossible to say if it was organic or the result of a lifetime on unnecessary medication. Hopefully, with a stable and proper therapy, he can keep making progress. Story 62. An 18 to 20-year-old woman ran into a small rural ER, dramatically clutching her stomach and pretending to be in severe abdominal pain. Why? A police officer had just clocked her going 40+ kilometers over the speed limit, which counted as stunt driving under Ontario law, an automatic license suspension, and vehicle impound. Instead of stopping, she panicked and sped straight to the ER. The cop followed her inside and, without missing a beat, told her, "I'll be waiting for you when you're done." At the time, I was a locum doctor, short-term contract, working in the area. In small rural hospitals like this, pre-printed order sets were done before the on-call doctor even arrived. When I got there, she immediately admitted she was faking it. She had just freaked out and didn't know what else to do. I told her she had 45 minutes to call her family before I discharged her. Then, plot twist. Her BHCG test came back positive. We sent her for an ultrasound, and it showed an extremely early ectopic pregnancy. The cop started getting suspicious when he heard an air ambulance request come over the radio. She went from faking an illness to accidentally dodging both criminal charges and a life-threatening emergency. One of the biggest WTF moments of my career. Story 63. Not a doctor, but I worked in healthcare for nearly 20 years. At one point, I took a break from the emotionally draining ICU and worked in home health. That's where I met a patient who clearly had Munchausen syndrome. Every single day, she would call her insurance company to ask what would be covered if she got diagnosed with this or that. She called her doctor's office at least 5 times per shift, reporting all kinds of symptoms, none of which were real. She pestered her doctors into performing exploratory laparoscopic surgery, which of course found nothing. One day, I walked in and caught her rubbing rotten cabbage into her surgical incisions to try to infect them. She wasn't even after pain meds, except to sell them. She was just as happy with antibiotics, stool softeners, or any prescription, as long as she got to go to the pharmacy and put on a whole performance about her allergies and reactions. She constantly exaggerated her symptoms too. First, she fluttered her eyes dramatically after making sure I was watching and said she had just lost consciousness for half a second. Then she called her doctor and claimed it was 5 minutes. Then she called her insurance and said 10 minutes. Then she called the pharmacy and said 30 minutes. Then she called 911 and said she had been unconscious on the floor for 4 hours. The worst part, she had a son. He was 28. And from everything she told me about his childhood, his countless illnesses, his severe disabilities, I realized she had completely ruined his life with Munchausen by proxy. She told everyone he was too sick and disabled to ever find a wife. I met him. He was perfectly healthy. He wasn't looking for a wife. He was gay. She just refused to accept that. Working with her was so miserable that I took 2 years off from healthcare after that. Story 64. During my trauma surgery residency, a prisoner came in after a fight, claiming he couldn't move or feel his legs. We ran CT scans and MRIs. Everything came back completely normal, so we did the usual tests. We shielded his legs so he couldn't see them and poked him with needles, applied deep pressure, things that should have made him flinch or react. Nothing. He was diagnosed with PSYWARA, spinal cord injury without radiographic abnormality, and kept in the hospital for a week. No improvement, always had a guard with him. One night, the guard had to step away to use the restroom. The prisoner said, "Where could I possibly go? I'm paralyzed." The guard left him alone for 2 minutes. Last seen sprinting down the road, completely naked, butt cheeks flapping in the wind. He made it 4 hours away by car before they caught him again. I have never seen anyone fake it so well. He was truly playing the long con. Story 65, dermatologist here. A patient was absolutely convinced she had melanoma. She insisted she needed a biopsy, said she'd have to go on workers' comp, the whole dramatic story. I looked at the spot and said, "That looks like ink from a marker." She refused to believe me and demanded a biopsy. So I took an alcohol swab, wiped the area clean, and showed her the completely normal skin underneath. She stormed out threatening to sue me. I'm just glad I cured her melanoma. Story 66. Had a patient come in for a fall. Now, they suddenly couldn't move their legs, completely paralyzed. We ran every test. Nothing. The weird part? They weren't fazed at all by their sudden paralysis. No fear, no anxiety, just vibes. I had 2 options. Admit them for an expensive, unnecessary workup. See if they'd suddenly regain their ability to walk. So, I went with option number 2. I told them, "Good news. All your tests came back fine. You're cleared to go home." They got up, got dressed, and walked. Story 67. My mom had been complaining all day about abdominal pain. It kept getting worse, so my dad and I drove her to the ER. We pulled up to the front entrance, and she proceeded to rip the loudest fart I have ever heard in my life. Not exactly faking pain, but it was hilarious. Story 68. Obligatory, not a doctor, but I was an EMT. We had a frequent flyer who rotated through various complaints. One of his favorites was complete blindness. Of course, we did our job. We got him on the stretcher, took his vitals, and transported him to the hospital. But every now and then, we had a little fun. One time, when he claimed he was totally blind, we casually observed the following. He walked a narrow, winding path from his trailer to the ambulance without issue. Once inside, he perfectly fingered through his wallet to find his insurance card. When we asked direct questions, he met our gaze and tracked our head movements. When I finally pointed all this out, his only response was to quickly look at something over my shoulder and stammer, "No, I'm blind."